times have you woken up after a long sleep with pain in your arms or your legs and just chalked it up to sleeping on them wrong? Or just another annoying Charlie horse in your leg? What about those irritating sports injuries where you think you've pulled, possibly torn a muscle, and your solution is to constantly ice and just rest it? Would these common occurrences lead you to believe you're suffering from blood clots? These exact same scenarios happened to my husband this past year, and those symptoms led to his diagnosis of deep vein thrombosis, or DVT, which was located in his lower calf. My having some previous knowledge about blood clots is what made my husband go to the emergency room and specifically ask about the possibility of a blood clot. But after researching, I realized that my knowledge was very, very limited compared to what I found. Although most people have heard the term blood clot, many are unaware of the symptoms, causes, side effects, and varieties of treatments used to resolve this extremely common and life-threatening health problem, all of which I would like to discuss with you today. There are different scientific names used depending upon where the clot is located. If it's in your leg, thigh, pelvis area, it's called deep vein thrombosis. If it's located in your arm, which is very rare, it's called venous thrombosis. According to the Mayo Clinic Health Letter, men and women are equally susceptible to being diagnosed with blood clots at one point, and our risk only increases as we get older due to certain things that happen to our blood as we age. Symptoms to look for are redness, tenderness, swelling, pain, burning sensation or itchiness, particularly in your leg. If it goes untreated long enough, you could also get skin ulcers. The problem with blood clots in particular is they can lead to a pulmonary embolism, which is when there is a blockage located in your lung, preventing any blood flow to lung tissues. Symptoms of you suffering from a pulmonary embolism would be shortness of breath, painful inhaling, fainting, wheezing, clammy skin, excessive sweating, weak pulse, and possibly coughing up blood. All of these symptoms can be intensified based off of the size, location, and number of clots you could have. Unfortunately, there are many causes to receiving blood clots, including research linking our environment to them, but there are many ways to be proactive to limit your risk of ever being diagnosed with one. Some preventable causes are inactivity, major surgery or long-term bed rest, surgery on the hip, knee, or pelvis area, women who take oral contraceptives before or after pregnancy, obesity, and smoking. Person's age, previous trauma, in particular a concussion, cancer, chemo, genetics, and family history, unfortunately aren't very preventable. Like I said before, research has been found to link air pollution to current DVTs. A Pakistani newspaper called the Balkistan Express reports that pollution contributes to cardiovascular system problems, and specifically particulate matter that's given off when fossil fuels are burned. A few years prior to this article, Ed Edelson, an author of Health Daily, wrote an article on Dr. Andrea Barcelli, who's an assistant professor at the University of Milan, about her research done in Italy, linking air pollution to increased coagulation and the increased diagnosis of DVTs. Just being knowledgeable about the certain causes can help reduce your risks. If you know you're a traveler, you're more susceptible to getting a blood clot just due to immobility while you're traveling. Movement, knee bends, toe raises, using compression stockings can also help limit your risk. Overall, exercise, hydration, and not crossing your legs also helps with your risks. There are a variety of treatment plans. The Mayo Clinic informs us about the different types. A very general treatment would be blood thinners or anticoagulants. There would be heparin, which is actually given intravenously, a low molecular weight heparin, which is an injection that you have to take once or twice daily, and then they usually will wean you to warfarin or Xarelto, which are oral medications, oral blood thinners. Emergency situations, they'll use clot dissolvers or thrombolytics, but they're not preferred because they can increase severe bleeding. At times they will use a catheter to insert a vena cava filter, which will actually be put into your vein, and it will trap any clots that try to travel up the vein into your heart or lung area. Severe cases, surgery, that's usually used whenever there's blood clots found in the brain. Treatments depend on your family history, genetics, and also previous diagnosis. If it's your first time diagnosis, they'll put you on blood thinners for about 3 months and monitor you. If it's a second or more, family genetic history, anything like that, they'll put you on blood thinners for 6 months, possibly indefinitely. I would like to leave you with a statistic given by Consumer Reports on Health, which stated that the Centers for Disease Control and Prevention reported in 2013, 600,000 people in the U.S. experienced DVTs and clots in the lungs, and 100,000 people die each year of pulmonary embolisms. It's very important to be aware of your body and know the symptoms to these blood clots.